Good morning. My name is Chinasa Onyeje. I'm a DMP student from Brandman University. My title today is Let Antibiotic Guidelines Guide Your Care. Reduce Bacterial Resistance Now. Antibiotic resistance. Number one cause of bacterial resistance is antibiotics overprescribing, followed by other positive factors such as patients not finishing their treatment, overuse of antibiotics in livestock, poor infection control, lack of hygiene, lack of new antibiotics being developed. This problem has a far-reaching implications because there are fewer developments of new antibiotics as shown in this graph. From 1983 to 1987, many manufacturers were inventing new antibiotics. And as you could see, it kept trending downward. By 2012, just a little, just very, very low. Not only are we faced with a dwindling invention of new antibiotics, more than 2.8 million antibiotic resistant infections occur in the United States yearly, and more than 35,000 people die each year as a result. The cost of overprescribing is equally enormous. And here are the predictions by CDC. By 2050, it is estimated that antibiotic-resistant superbugs created by overprescribing will kill more people than cancer. Approximately 55% of all money spent on antibiotics in the US in 2015 could be attributed to outpatient environments. Antibiotic resistance added $1,383 to the cost of treating a patient with a bacterial infection. Antibiotic resistance has an estimated national cost of $2.2 billion annually. Approximately 23,000 patients die annually due to bacterial resistance, but this number has gone up to 35,000 people. National Action Plan for Combating Antibiotic-Resistant Bacteria. The cost of CDC indicates that 30% of antibiotic prescriptions are unnecessary. The right antibiotic dose and duration are not selected for the 70% antibiotic prescribed, which were actually necessary. And the goal set by CDC is to reduce inappropriate antibiotic use by 50% in the outpatient settings and 20% in the inpatient setting. In light of this, I have also created a flyer to help educate the providers and the patients of the importance of judicious antibiotic use. To the prescribers, educating your patients that antibiotics do not work for virus is very important. Do not bow to demands for antibiotics when they are not needed. Always check yourself. Is antibiotic appropriate for your patient's symptoms? Take a pause, look at the guideline. Does it support your decision for antibiotics? Select the appropriate antibiotic spectrum to prescribe only when it is needed. Be sure the duration of antibiotics prescribed does not exceed guideline duration. Educate your patients to complete their course of antibiotics and not to use someone else's antibiotics or keep a leftover for another time of illness. To the patients, antibiotics only work for bacterial infections. Antibiotics do not work for viral infections. Common cold or flu are caused by virus. You may have a sore throat and earaches and yet not have bacterial infection. Unnecessary use of antibiotics can result in bacterial resistance, making the antibiotics not work anymore for the bacteria. A demand for antibiotics when not needed may lower your immune system if given. Prevention is key. Proper hand hygiene and sanitary environment helps. I've also included the CSMART facts about antibiotic use that I found on CDC website. And it talks about how antibiotics are life-saving drugs and should only be used when needed. Antibiotics only treat bacterial infections. It supports what I had just put on my flyer. And even when you have green colored mucus, it's not a sign that you actually need antibiotic because, viral, even allergy can change your secretion in the mucus. It can change the color of it. And here are my references where I retrieved the information that I provided this morning. I thank you for listening. You have a great day. Thank you.